Yes, hello Lodge. Yes, I can hear you. Sorry I couldn't join you for the closing session, but I'm here already in Amsterdam to explore whether this is a suitable city to host the third European Conference on Public Health. And actually it looks promising. For example, if you look at the building over there, the entry port to Amsterdam, you should realize that that was not only in the 17th century the Waag, the commercial center for the guilds, but also the place where on the first floor you'll find the anatomical theater of the surgeons. Thus, commerce and medical care were already integrated, and actually the painting that was painted for that place, the anatomical lesson by Nicolaas Tulp, was painted for this particular place. And the person Nicolaas Tulp himself already integrated public health. He was not only the chief surgeon of his time, but also the mayor of Amsterdam. Thus, historically, a good city. Let's move on. Amsterdam is now a vibrant city of 765,000 inhabitants. Only 50% of the inhabitants are native Dutch. That means that we have a large group of migrant populations, mainly from Suriname, Turkey and Morocco. About 1/3 of the people living in the city are traditional families, 1/3 live on themselves, and 1/3 have other living arrangements. That constitutes a nice mix of public health problems. Also given the fact that every year about 3.6 million tourists are visiting the city. The Netherlands has a lot of public health policies in place, like a ban of smoking in public places. However, a city like Amsterdam has specific priorities. Psychosocial health of the population, sexual health of youth, and that's far more than just the control of STDs, of prostitution, like you see depicted in this neighborhood, but also policies in relation to recreational drugs, and, very important, policies to try to prevent obesity. Exercise is really stimulated, and that's not just by using a bike, but also having facilities in neighborhoods to make it possible for children to be active, like the initiatives of the Johan Cruijff Court for playing soccer. In this city you will find a lot of examples where the city tries to integrate public health in daily life. It seems a good place to host a conference on the topic. So, the central theme for next year will be integrated public health. And we will try to address this theme by 5 sub-themes. The first sub-theme will be integrating research in policy, practice and education. So this theme will focus on things like evidence-based policy, an important aspect of having an integrated approach towards public health problems. The second theme will be integrated policies, integrating public health in all kinds of policies outside the classical healthcare arena. Public-private partnerships will be an important topic to address under this theme. How to make industrial partners involved in public health issues. That's the question. The third theme will address integrated information. It will look on a European and a national level how we can integrate the various data sources that provide us information about the public health of populations. A major challenge in the 21st century. The fourth theme will address public health professionals. We will see how we can integrate knowledge and skills in today's professionalization processes, looking at the workforce of public health and trying to figure out how public health professionals of today can perform at best. And finally, the fifth theme will address the integration of prevention in regular care, like primary care and hospital care, a real challenge in this century. So, 5 themes to address integrated public health. Okay, let's come and find the conference site. Here we are, the Rye. A very appropriate location, as this is the place where the bicycle industry about 100 years ago had their exposition site. Today you will find a very modern conference center with all facilities, on an easy 20 minutes away from Schiphol Airport by train. I would like to invite you on behalf of the Dutch Public Health Federation, NPHF, the Dutch Institute for Public Health and the Environment, the RIVM, the Dutch Research Institute for Applied Research, ZONNB, and the Dutch Institute for Health Services Research, the NIVEL, to come to the next conference of EUPHA and ASPHER here in Amsterdam from November 10 to 13. You're most welcome, and please don't forget to bring your umbrella. See you next year!